Hello students, this is the next topic of the subject pharmacy practice, that is known as a drug information center and a poison information center. The poison information center is started, it is given as the place or unit or office providing information on prevention, early diagnosis and treatment of poisoning and risk management. So that particular unit will give the information related to how to prevent the poisonous, that is unintentionally poisonous should is there, how to prevent, then how to diagnose that poisoning cases, what are the parameters to diagnose, like slow breathing, dizziness. These are the symptoms that is known as early diagnosis. And treatment of poisoning, that is which type of drugs, for famous drug that is atropine has been generally used for the poisoning cases. And risk management. So these all information is comes under one heading, that is known as a poison information center. Then poison information center is important for assessing and treating poisoning. You have to assess the condition of the patient. Condition of patient means meaning patient condition may be mild, moderate or severe. This type of condition should be assessed, is very important. And by the way, we can given the this type of treatment and treating the poisoning cases. Then poison information center help in minimizing or preventing the poisoning cases. If poison is available nearby or whatever the cases, we should keep properly or secretly this type of poisoning materials or chemicals, so that so we can minimize or prevent the poisoning cases. Then improve the health of the public by minimizing morbidity, mortality due to poisoning. Morbidity means consequences and complications are produced due to the poisoning cases, that is known as the morbidity. And mortality means a number of deaths due to the poisoning, that is number of deaths to the 100 peoples, how many deaths are caused due to the poisoning. So that should be improved by using the poison information center. Then poison information center accept the query related to the poisoning either over the phone or in person or by email. So that should be covered by the poison information center. We can query means questions can be asked to the this particular center, and this center can give the information related to the poisoning cases or poisoning informations. Then poison information center should collect all the information of patient and inquirer. So it will collect the information of patient, what is the name of patient, what is the geographical area of patient, and then all the information regarding the patient and inquirer who is inquiring the patient or information. So that should be store the data of into the poison information center. Then assess the importance of situations such as condition is an emergency, serious, not serious or no problem. That is you have to consider the that particular situation is maybe emergency cases, in or maybe serious or serious. So that is under the by using the information from poison information center. Then poison information center sources, from where these sources or where the information is gathered by the poison information center. How to collect the information by the poison information center, that is the PIC sources are same as the DIC. DIC means drug information center, which include, these are the centers of poison information center and drug information center, that include primary, secondary and tertiary sources. So what are these sources? These sources are considered, or they can take the information in terms of primary, secondary and tertiary. Then a database like a poise index. Poise index is the database from which can collect all type of information. Which type of information? That is we can prevent the poison cases, then early diagnosis and treatment or risk management. This type of the information is taken from the poison information center. And poise index, then different types of textbooks like pharmacological textbook, pharmacy practice textbook, adverse drug reactions and other reference books. From this we can take the sources. These are take the information by the poison information center. They collect the information from the sources, primary, secondary and tertiary sources. Then how working of the poison information center. It will work in the different steps involved are there. The steps involved in the PIC, that is poison information center, work are one. Number one, collection of requesters inquirers information. They should collect the information from the requester and inquirer. Collect the data of poisoned patient, how many patients are there, and which type of poison they have taken, and what is the condition of the patient. This information is taken, that is known as the collecting data of the poisoned patient. Then evaluate the condition of patient. The condition, as earlier said, it patient may have the mild conditions, moderate and severe or emergency type of patients is there. So that should be evaluation is should be taken place. Then gather the information of poison and its adverse drug reaction and its therapy. Gather the information of poison, which type of poison is there. So many classification of the poison, there's chlorinated poison, phosphorus poisons. Okay, so these are known as a poisonous conditions and its adverse drug reaction. What are the adverse drug reaction? Poison will produce the damage of the body, and which extent it damage the body, that can be assessed or evaluated. And adverse drug reaction. Therapy, which type of therapy should be given. Generally atropine is recommended for this poisoning cases. Analyze and provide the information on poisoning. We should analyze, evaluate and provide the information on poisoning. They can give the information regarding the poison, which extent or which type of therapy can be used, or which type of medicine can be used for this type of poisoning. Follow up and record keeping. Following condition of the patient should be followed, and record keeping, you should take the record of the patient, and it is morbidity, mortality or recovered type of patient, that should be record, all type of record. What is the admitted patient, and what is the time of admission, and what is the time of discharge. So all these of information should be known as record keeping. Then maintain confidentiality. So the patient's name or its condition should not be made public, or any other unrelated patient should not be given. Then next, the steps involved in the PIC work, that poison information center work, are collection of request information, that is name and contact of requester is collected. Who is requesting the information? So all type of information requesting person should be collected. Collecting data of poisoned patient. Collect data of poison substance and victim, like age, what is the route of poisoning, from the eyes, nose, throat, ear, or injection or oral, this type of the routes are there. Then what is the weight of the patient, and time of contact, on which time the patient has encountered with the uh, poison, that is known as the time of contact. Then what are the symptoms? Symptoms are very general, that is dizziness, breathing problem, that is dyspnea or asthma like conditions, and confusion state of mind. These type of the symptoms are there. Then treatment, if any done, if already treatment, for example vomiting, so many patients are our relatives are taken the vomiting to the patient, so that's a poison into the stomach can be extract out of the body. So this type of the primary treatment is taken or not. And is any type of the allergy to the patient. Allergy condition is very important to the information why, if the allergy of the diclofenac or aspirin is there, and the same drug is given to the patient, they will produce the high risk patient to the high risk condition will be occurred to the patient. So allergy should know by the doctor. Then evaluate the condition of the patient. Check the condition of the patient as an emergency, always serious, not serious or no problem, and treatment is required or not. Generally, if there is a poisonic cases or a condition or patient is there, the treatment should be given to the patient. So it's rarely that patient does not require any type of the treatment. Then PIC work in next continue, that is the gather the information of poison and its ADR and therapy, adverse drug reaction and therapy should be informed, gathered all type of information. Search the information of poison and its treatment in PIC sources like textbook. Different types of pharmacological or pharmacy practice textbook have the treatment of poisoning cases. Analyze and provide the information on poisoning. review the correctness of collected information and provide the information verbally, written, printed, or mailed to the patient. So generally, as to the emergency, you should write the prescription, that is doctor should write the prescription, review it, analyze the conditions, then follow up and record keeping. That's we already given the information on that. Inquire the well-being and usefulness of information and record, keep the record. So that record should be keeping by the patient, poison information center of the patient. Then maintain confidentiality, so do not disclose any information to any family member or medical staff without consent of inquirer. So the patient or inquirer is there, so they should not, the center, poison center should not made public the information, said how many he has taken the poison or not, or his medical condition should not made the public. Then drug information center, so drug information center and poison information center working is normally same. There is no major changes into the centers of poison information and drug information. The place which provide written or and or verbal information about drugs and drug use to the request from healthcare providing organization, medical staff, patients and committees. So that should be a place where we can get the information of drug, chemical drugs is there. That should be very important to the medical staff, patient, as well as the any type of multi-speciality organization. Then drug information center refers to the facility which provide the detailed drug information to medical staff such as pharmacists, physicians, etc. as per their need. So all information should be available by the pharmacist and physicians or any other medical staff. Then drug information center are very helpful to increase awareness of drugs and their uses. So this is nowadays very important. If any person related to the medical staff or pharmacy staff, they directly taken the medicine without the consent to the doctor or without prescription. So that maybe should be aware to the patient that, or any medical staff, that they should not take the medicine without doctor's advice or prescription. So that may lead to the very harmful effect onto the body, like organs like liver and kidneys can damage to the due to the powerful chemicals. Objective, what are the general objectives of the drug information centers? So what they should achieve by this, using these objectives: to provide the complete database of medicine and it used to the medical staff. Complete database means its general name, chemical name, its properties, its uses, its side effects, what are the other consequences, allergies. So that should be all information database is gathered to the drug information center. To provide the accurate and unbiased medicine information to medical staff. So all the medical staff should give the information. It shouldn't happen that one person getting information, one another person not getting the information. That shouldn't be happen. Then to educate the pharmacy students, so they can produce the new information and they can give the training to the new pharmacy students. They take training completion like that, so that they will have the all type of information to the medical staff. To promote the rational use of drug by providing knowledge of medicine. Rational use means proper use of the drug should be taken your place, not the maximum dose. If the any drug have the dose of 5 days, you should not give this dose of these drugs to the 10 days, 15 days. So that is known as the rational drug of use by providing the knowledge of medicine. Not long term should be given. Long term treatment should be given to the different types of disease like TB or HIV. They are have the long term type of medicines. Other diseases that do not require the long term medicine, not required. So the information should be given to the knowledge to the of medicine to the medical staff and pharmacy to their pharmacist. Then to improve the patient care, you should improve the patient care by using this type of all type of information. That is known as the objectives of drug information center. So that is the end part of part A of poison information center and drug information center.